Today we're diving into a new law that's reshaping health insurance options in the United States, especially for early retirees. It's called the One Big Beautiful Bill Act, and whether you're already retired or soon to be there, there's some important information that you should know. From expanded health savings accounts to changes in marketplace options, we'll break it all down in today's video so you understand how it affects your finances and your health coverage. So let's get some context here. The One Big Beautiful Bill Act is a sweeping tax and budget law with some major health insurance implications. Certain provisions expand health savings account eligibility, codify telehealth access, and change how bronze and catastrophic coverage plans are treated for savings accounts. But other parts of the law may have consequences for marketplace coverage and subsidy structures, especially for early retirees. We'll unpack all of this and discuss how it affects those planning to retire early before reaching Medicare age. So first I want to talk about a very exciting change, which has to do with health savings accounts and expanded eligibility. Beginning 2026, many more people will be eligible to contribute to a health savings account. That is because of the IRS guidance and law changes affecting bronze and catastrophic marketplace plans. These will now be treated as HSA-eligible HDHPs, even if the plan does not strictly meet the HDHP criteria. This is especially great news for early retirees because of the triple tax advantage offered by HSAs. An HSA is a health savings account. It's an account with your money in it. Now, your contributions are pre-tax, therefore lowering your taxable income, or your MAGI, modified adjusted gross income. Your modified adjusted gross income is what the marketplace looks at when determining your eligibility for a premium tax credit. And because there have been other changes with premium tax credits, this is more important than ever before. So this can help you to save money when you file your taxes, but as I said, it can also make you eligible for a larger premium tax credit. So it'll help you to save money in two ways. Now, HSAs are accounts that are interest-bearing, and the interest accrued is also not taxed. And you can choose to invest a certain portion of your HSA, and the earnings on those investments are not taxed. Now, every year, the IRS sets maximum contributions to HSAs, and in 2026, the maximum contribution for an individual plan is $4,400, and for a family plan, it's $8,750. This does not include the additional $1,000 catch-up for those 55 and older. That means that based on the type of plan that you choose and how old you are, you may be able to contribute almost $10,000 to your HSA. That's a significant tax savings regarding when you file your taxes and, of course, when becoming eligible for those premium tax credits. So prior to the enactment of this law, you would really only be eligible for an HSA if you were enrolled in an HDHP, which is a high deductible health plan. And then, of course, that HDHP would have to offer an HSA as an added benefit. Now, very often, these high deductible health plans had very high deductibles, often that were the exact same as your out-of-pocket max. So very little would be covered prior to meeting that high out-of-pocket max / deductible. And even though usually we would see plans with higher deductibles having lower monthly premiums, when we were talking specifically about plans that offered HSAs, very often we wouldn't see those savings reflected there. But now HSAs will be available for bronze level plans and catastrophic coverage plans regardless of their HDHP status. That means that you could see a plan with a much lower monthly premium and that HSA bonus as well. Now, this couldn't come at a better time because we are seeing some negative changes in 2026 as well. And that has to do with the expiration of those enhanced premium tax credits made available under the American Rescue Plan Act and the Inflation Reduction Act. So it is important to note that premium tax credits are not disappearing entirely, but those enhanced premium tax credits that we've seen for the past 5 years did expire at the end of 2025. Now, there is currently some legislation that may or may not be passed, hoping to extend those enhanced premium tax credits for an additional 3 years, and we will make sure to keep you posted. That's why it's very important that you make sure to subscribe to stay up to date. We do release these videos on a weekly basis, and please make sure to like this video so we can get this information out there. Now, if you have questions, you can reach us in the comments below or at the number on the screen. We're licensed health insurance brokers, we're licensed nationwide, and there is absolutely no charge for our services. All right, let's get back to it. Now, as I mentioned, these enhanced premium tax credits did expire at the end of 2025. That means that if you're someone who utilizes a marketplace plan, it's highly likely that you're going to see your premium increase by quite a bit. So contributing to an HSA may be your best strategy available. As I mentioned earlier, if you are someone who is enrolled in a family plan, contributing the maximum to your HSA, and if you're someone who's eligible for that $1,000 catch-up if you're 55 or older, that means that you could potentially lower your MAGI by almost $10,000. That could potentially push you into a much lower tax bracket, making you eligible for a much larger premium tax credit, or now that that premium subsidy cliff has been reintroduced with the expiration of these enhanced premium tax credits, you could be eligible for a premium tax credit even if you weren't eligible before. But under the One Big Beautiful Bill Act, there will be stricter income verification, so please make sure you have all your ducks in a row. And of course, if your income changes, if your household size changes, anything like that, make sure to keep your information up to date on healthcare.gov so you're not hit with an unexpectedly big tax bill when it comes time to file your taxes. Because remember, a premium tax credit is just a tax credit that is paid up front, reflected in a discounted monthly premium. Now, if you underestimate your income and you're no longer eligible for that premium tax credit, when you file your taxes, you're going to have to pay it back. Another practical impact for early retirees has to do with telehealth and DPC, which is direct primary care. So what is DPC? DPC is direct primary care. It's an agreement between you and your primary care physician. It's not insurance, although it sort of does function in a similar fashion. Basically, you'll pay a monthly membership, not a monthly premium, and that will allow you greater access to your doctor for more basic services. Now, very often, people will have some type of DPC agreement in place in conjunction with a catastrophic coverage plan, because DPC will really only cover your interactions with your primary care physician. Should you need to be hospitalized, and that's where those big bills come into play, then you wouldn't have any coverage. That's why it's always recommended that you have a catastrophic coverage plan or some type of additional health insurance plan with DPC. Under the One Big Beautiful Bill Act, remember, catastrophic coverage plans are now HSA eligible. Another huge change is that with an HSA, you have a list of qualified medical expenses that you can use your HSA funds for without any type of penalty. Now, paying for your membership for DPC is included in the list of qualified medical expenses. And another big change has to do with telehealth. Personally, I'm a big fan of telehealth. And under the One Big Beautiful Bill Act, you can actually access telehealth services prior to meeting that deductible / out-of-pocket maximum when it comes to high deductible health plans. That means that rather than having to meet that deductible, regardless of what it may be, you'll have access to telehealth services. Again, this is another big deal because if you have a plan with a higher deductible and you have something simple to treat like a sinus infection, you can use telehealth to have access to your doctor and receive your prescription that way without having to pay hundreds or even thousands of dollars to go to some type of facility. So bearing these changes in mind, what should you do if you're planning on retiring early? Evaluate your coverage options. Marketplace bronze or catastrophic plans with HSAs might be the best option available to you. Also, make sure to maximize your HSA contributions. Contribute as early as possible in the year if eligible, and use those HSA contributions to lower your MAGI. Also use traditional financial planning. Think about health costs between early retirement and Medicare eligibility at age 65. You can use those HSA funds to supplement budget gaps. And of course, continue to monitor those subsidy and marketplace changes. That's why, again, we recommend you subscribe to stay up to date. Now, if you have questions, you can reach us in the comments below or at the number on the screen. We're licensed health insurance brokers. We're licensed nationwide, and there's absolutely no charge for our services. Also, please make sure to like this video so we can get this information out there. And if you want to learn more about some health insurance options for early retirees, I'll put this video over here as well as our All About Marketplace playlist. We'll see you next time.